Good day everyone. In this video, we are going to introduce Tuina techniques. Tuina, the other words for Tuina is 按摩. 按摩, it refers to massage. 按摩 the techniques can be dated as early as 221 BC to 220 AD. During this period, there was one book, although it had been lost now, called 黄帝岐伯按摩. So in this book, it's actually a monograph on Tuina techniques or massage. And afterwards, during 走后备旧处方, this book was written by Ge Hong around 300 AD. This book also mentions some techniques about massage. The terminology of Tuina only emerged in the 16th century. So from Huangdi Neijing period until 16th century, we actually refer to massage. But the difference between Tuina and massage, or the Chinese medicine massage and the normal massage, is we not only focus on relaxing, but we also focus on the therapeutic effects. So we actually use the Tuina techniques or massage techniques, different techniques, and combined with the efficacy of acupoints and meridian, still based back to the theory of Chinese medicine. That's how we can, apart from relaxing, we also can achieve therapeutic effects. Tuina is also very commonly used in pediatrics because children, they don't like needles. So if you don't, the theory and the applications are actually exactly the same as acupuncture, but instead of using needles, you're going to use your hand. You're going to use your fingers or your palms instead of needles. So it's commonly used in pediatrics. For example, in the history, we have quite a few monographs on Tuina techniques on kids. For example, 小儿推拿活音全书, written by Gong Tingxian, compiled in 1571 AD. 小儿 means children. 推拿活音全书. 小儿推拿秘诀 still 小儿. Whenever you see 小儿 or 幼科, you actually refer to either kids or pediatrics. So all these are the monograph on Tuina techniques on pediatrics. Tuina techniques not only used on children but also adults. We also can use Tuina for both, for relaxing purpose or for treatments. In 2017, in the therapeutics, I introduced one case that I met on the mountain for acute myocardial infarction. So at that time was in 2017, while I was hiking on the northwest of Johannesburg. While I hiking on top of the mountain, I met one patient. The patient suffered from a heart attack, and this actually suffered from acute myocardial infarction. So at that time, I didn't have a needle with me. So what I was doing is I'm using my thumbs on both hands, my thumbs as needle to massage on the patient. So this is actually the successful case from Tuina. From this case, this is actually coincidence. From this case, you also can see the evidence. Tuina techniques, if you apply well, it not only can be used for relaxing, also for treatments. Even this type of acute condition and critical condition. Acute myocardial infarction, even in hospital, the mortality rate is also high. So this is actually quite an interesting and very rare case. But from this case, you can see the efficacy of Tuina. So this video was taken after the events. So after we came back, we just demonstrate on one patient what did I do at that time. So from here, what I was doing is I'm using my thumb as the needle to press on the acupoints and along the meridian. The mechanism of Tuina therapy. Unblock the meridian, promotes the flow of qi and blood circulation. It also align and restore the tendons and enhance the joints flexibility, regulate organ functions, strengthen the disease resistance. So from these mechanisms, from these functions, you can see Tuina techniques not only focus on the muscles, but still we link back to the internal organs. So that's why it says Tuina techniques, we still need to base back to the theory. It's exactly the same as acupuncture, but instead of using needles, we use your fingers and your hands. And also for joints problem, for example, the limitation of joints, and then we can use Tuina. That's why in the second mechanism, we can align and restore the tendons and also enhance the joints flexibility. Because Tuina, we work on the muscles directly, so you have a better effect on muscles. Can release the muscle, can release the tendons, to release pain and also the limitation of the movements. Tuina is a traditional Chinese medicine therapeutic massage that involves various manual techniques such as kneading, pressing, rolling, stretching, stimulate acupoints, meridians, and muscles, used to promote the flow of qi and blood, relieve pain, correct musculoskeletal imbalance, and support overall health. So we can use Tuina for general health, for treatments. Tuina is often combined with other modalities such as acupuncture or herbal therapies. So for example, for acupuncture treatments, you can perform Tuina before your acupuncture treatments just to release the tension of the fatty area. The principle of Tuina, so we still need to base back to the holistic concepts. The treatment based on syndrome differentiation. So doesn't mean for Tuina practitioners you don't need to differentiate syndromes. You still need to, because you will work on syndromes. Apart from the primary focus on the muscle, but you also you can work on the root cause. So we treating both the root causes and the symptoms, balancing the current and the long-term care. The movement as a primary focus, integrating motion and stillness. Tuina, in general, I would say is quite safe, but they do have some incidents, but because of the lack of knowledge, so it's important for all of us to understand the Tuina techniques when you should not apply. So the common causes of the incidents are unclear diagnosis or misdiagnosis, lack of understanding of the disease, and the principle of manual therapy, improper application or selection of the techniques, or failure to consider the indications and contraindications of the Tuina therapy. So these are the causes in academic language, but just in layman words, mostly what happens is, if you don't know the disease or you don't know the contraindication of the disease, for example, if a senior patient suffer from the bones in lack of calcium, so have the calcium deficiency, the patient may have fractured easier. The bones become more fragile. So in this situation, you should use a lighter force instead of the aggressive force, so that can prevent the incidents. And also Tuina techniques, if the patient experiences skin disorder, we also don't apply on these. And for Tuina techniques, in part of Tuina techniques, we also can set the bones. So this is very similar to chiropractic. But while you're setting these bones, You need to be careful when you twist the spine. You need to have proper techniques. You need to be careful that you must know the techniques to avoid the instance. Otherwise, it may cause critical consequence. In order to enhance the efficacy of Tui Na techniques, the practitioner, we need to strengthen our qi, or we need to strengthen our body constitution. But how to strengthen our body constitution is you are advised to practice qigong exercise. There are quite a few qigong exercises we're going to introduce later, but most importantly, you need to train your fingers. You need to train the force of your fingers, the flexibility of your fingers. After training your fingers, you not only contribute benefits the Tui Na techniques, but this also will benefit your acupuncture techniques. So you are advised to train your fingers. But how to train your fingers? You can do push-ups, the normal push-ups. Afterwards, you can try to use your fingers, the finger push-up. So you use the 5 fingers or 3 if you can to push on the floor. For females, you may try to do a half push-up, which means you can put your knee on the floor and then only the upper body for the push-up to strengthen the strength as well. But if you still can't do this, what you can try to do is you can stand against the wall, similar to this gentleman. You push the fingers against the wall, so similar to in this way. So you push there, your body link on the your body link against the wall. So you actually pushing on the wall with your fingers. You can practice this like 5 minutes a day, a few times a day, 5 minutes each time and a few times a day. And then gradually you can practice longer. You can have the duration longer and longer. Just be careful that you don't force yourself in the first few days, because once you injure your fingers, if you experience pain, it's quite difficult to heal. So you need to wait for healing. So just be careful. You need to warm up. You need to start gradually, and then you can strengthen your fingers. So this is how to strengthen your upper body and your fingers, your hands. The second is the squat. The practice of squats, you have 2 different types. One's this, the other one's this, like this. The reason why you need to practice squats is because when you perform Tui Na, as well as when you perform acupuncture, we don't want you to bend your back, because once you bend your back, you're going to hurt yourself, especially after long-term treatments and long-term practice. If you bend your back for a few hours continuously, you're going to have problem with your back. So as a practitioner, we hope you can be healthy while you're performing all these. Especially for Tui Na, the duration of Tui Na, it takes quite long. It may last for 30 minutes, 40 minutes, even more than 1 hour. So if you bending your back and practice Tui Na for such a long time, you're going to have problem. So for instance, if the palms or the table is too low compared to your height, you should squat instead of bending your back. Then you can keep your upper back, your head in one straight line. That can help you to keep healthy. So you can practice this, and see how long you can stand. So you should stand like 1 or 2 hours if you can. So these 2 are critical to strengthen your fingers, your hands, and also strengthen the muscle on your legs. So you can practice these. For push-ups, you can keep like 100 times or even 200 times, and then that can strengthen your strength quickly. And afterwards, we're going to introduce 3 exercises. The first one is 八段锦. 八段锦 is an ancient qigong exercise focusing on meditation and breathing. It will benefit one's health significantly after long-term continuous practice. There are 8 movements in total, and it is very convenient for everyone to practice anytime and anywhere. The first movement, holding the hands towards the sky to regulate the sanjiao. In this movement, you need to raise your hands above your head as much as you can, and your head should link backwards. The second movement, pulling a bow from left and right sides. In this movement, you need to stretch your both hands against each other. The third movement, raising one's hand to regulate the spine and stomach. In this movement, you need to stretch your hand once towards your head, the other one next to your waist. You're going to stretch against each other. Looking backwards to heal deficiency. In this technique, your shoulder should not move. Your eyes are looking at your heels. this is the full set of the 八段锦 exercise. If you see the video is not that clear, what you can do, you also can search in the channel with 八段锦. So I have the specific video for this exercise. The 八段锦 exercise is compared to the other exercise, this Qigong exercise is convenience, also easier to learn. It's because it's simpler than compared to the other ones. While you practice, you can practice the full set from the first movement to the 8 movements. You also can practice parts of these exercise. For example, if you are working in the office, some of these movements are good for the cervical problem, your neck, your upper back, and some also it's good for the pain in the upper back. And for example, there's one movement that you're looking at the back while you're doing this, but while seated, because for example, if you are working in office, if I work in front of a computer, I may have the neck pain or upper back pain or shoulder region. What can I do? I can look back. So what you can do, you can put your head up and then turn your head towards one side and look at your shoulder. If you can look at your shoulder, you can look over the shoulder to your hip, and you can keep stretching for 5 to 10 seconds, and then you move back to the center. You can feel the muscle stretching, and then you can also practice on the other side. You look upwards first, and then turn to the other side. You keep stretching for 5 to 10 seconds, keep stretching, and then you move backwards. So like this type of exercise, you can practice by yourself. You also can advise your patient. For example, your patient, when they suffer from neck or upper back problem, you can advise them to practice as many times as they can, because this exercise also convenience. No matter where you are, it's quite easy and simple for you to practice. It doesn't really need a lot of time and space, and this is also quite effective for the neck problem. For someone suffer from shoulder upper back pain, for example, if the pain, especially for the pain that's in between the scapulars, so what you can do is see this movements. You can stretch in each other. Also while seated, you can turn the other side as well, and then you can stretch. So for example, if you stretch on the other side, you pull your hand against each other. In this way, you're just stretching your back, and you can feel like you're stretching your scapula. So these techniques you can practice like formally the full set or 1 or 2 of the movements. You also can advise your patient to practice these. For Qigong exercise, the focus is not only the movement but also your breathing. So while you practice, you need to take deep breath in and out slowly, and then this can strengthen your qi. The next one is Tai Chi Chuan. Tai Chi Chuan is slightly more comprehensive, but also it is worthy to learn. So this is the full demonstration of Tai Chi Chuan. The full demonstration it take about 5 minutes. You also advise to practice the Tai Chi Chuan as many times as you can. The more you practice, the better your efficacy will be, and also you also can be healthier, because Tai Chi Chuan also can be used to maintain health. Similar to Ba Duan Jing, some of these movements you can practice as a full set, or if you practice only part of these, you also can use for some to relieve some diseases. Still, for example, for the pain in the upper back, the cloud hands, what you can do, you also can do this. So you see, in this way, I actually turning my spine. So in this way, when you practice this, you will see you can feel the movements of the muscle between the scapulars. So this can help to relieve the pain in between the scapulars, and these will strengthen the efficacy from your acupuncture treatments and your trainer treatments. For example, patients are from the pain along the inner border of the scapula, you can do acupuncture on there, and then you can perform trainer as well. In the meantime, you can provide patient advice to advise the patient to practice cloud hands. So in this way, you can make the efficacy longer, remain the efficacy longer. You also can improve your therapeutic effects. So the outcomes of your treatments. So this is Tai Chi Chuan. Tai Chi Chuan also, this video also available on YouTube. And the last one is Tai Chi Sword. This is Tai Chi Sword. So to improve the efficacy, to of the Qigong exercise, there are a few that we recommend. The first and the most important ones is to strengthen your fingers and your hands. To practice squats to strengthen your muscles of your legs, and then afterwards you can practice 八段锦, you can practice 太极拳, you can practice 太极 sword. So these a few exercises can promote the efficacy, but also these a few exercises can promote your general health. So it benefits yourself as well. And afterwards, we're going to introduce the manipulation techniques